Resident Dr. A works at a general hospital. A 78-year-old man, B, was diagnosed with terminal pancreatic cancer and currently receiving chemotherapy. Dr. A began a treatment consultation and attempted a physical examination. As he removed B's shirt, he noticed that B's upper body was covered with elaborate tattoos. B then proudly stated that in his younger days, he had held a high position in a criminal organization. He also confessed that he had once fought with members of another group and committed murder. Dr. A was shocked and frightened, but simply acknowledged what he heard and left the room. Now Dr. A wonders, should he report what B confessed to the police?
Personal medical information contains extensive private details. If such information is leaked, it can seriously infringe on a person's privacy and have far-reaching consequences for their social life. For example, if information about pregnancy or miscarriage becomes public, it could destroy family relationships. If a history of cohabitation becomes known, it might create problems for future marriage prospects. If it is revealed that someone has received treatment for a sexually transmitted disease, HIV, or a mental illness, the person may face social stigma, employment discrimination, ostracism, or damage to their reputation. In the worst cases, such information may even be exploited for blackmail, phishing, or other scams. For these reasons, physicians must use patients' personal medical information solely for treatment and must not disclose it to others. However, information obtained during treatment may include details of past crimes or information that could threaten the lives of others in the future. Should a physician report such facts to the authorities? If the physician withholds such sensitive information, it could endanger public safety or obstruct justice. On the other hand, disclosing the information without the patient's consent would violate the physician's duty to protect patient confidentiality. Moreover, if patients believe that their private disclosures or medical information might be revealed, they may withhold important information during treatment, leading to misdiagnosis or inadequate care. In South Korea, there have not yet been any legal cases directly similar to this scenario. However, there has been a similar case in the United States. In that case, a university hospital counselor learned during a counseling session that a student was planning to kill his girlfriend. The hospital was informed but failed to warn or protect the intended victim. The student ultimately killed his girlfriend. The court ruled that the hospital was liable for not taking preventive measures despite having prior knowledge. This ruling suggests that protecting an imminent threat to another person's life outweighs the duty to protect patient confidentiality. So, how does Korean law address such situations? Under the Medical Service Act, physicians as well as nurses, administrative staff, and others involved in patient care are prohibited from disclosing or publishing any information obtained in the course of providing medical treatment, midwifery, or nursing. Importantly, the law refers to information, not just secrets. Information includes not only personal medical information, but all information related to the patient. Before 2016, the law referred to secrets instead of information. Secrets refer to facts that are not publicly known and are deemed worthy of protection. The law was revised to information because legal disputes frequently arose over whether the disclosed details qualified as secrets. After the revision, any information obtained during medical care must not be disclosed to others. The physician's duty to protect patient information applies only to information learned in the course of treatment. For example, information heard at a private dinner party from a friend is not included. Disclosure refers to revealing patient information to third parties unrelated to treatment. Sharing information with healthcare professionals involved in the patient's care does not constitute a violation. Even disclosing information to a single third party can violate the law. There are exceptions, however, when patient information may be disclosed. First, disclosure is permissible with the patient's consent. Second, when the patient has an infectious disease. Public health takes precedence over individual privacy to prevent transmission. Third, if a court requests medical records during litigation, disclosure is required for a fair judgment. Fourth, de-identified information can be used for purposes such as AI training and big data analysis. Finally, information can be disclosed for the protection and promotion of public health and in the public interest, such as to protect another person's life in the face of imminent danger or for reasons of social justice. In such cases, however, the disclosure of private information must be carefully balanced against personal privacy, freedom, and human dignity. Authorities must consider the urgency of the situation, whether less invasive alternatives exist, and whether disclosure is truly necessary. In the case described above, the patient's murder confession concerns a crime committed in the distant past. The patient is elderly, terminally ill with pancreatic cancer, and does not appear to pose an imminent threat to others. Under these circumstances, reporting the confession to the police would likely not fall under a legal exception to the physician's duty of confidentiality. What do you think of this case? Please leave your thoughts or opinions in the comments.